I mentioned that there is a lot of room for improvement, and certainly there are many newer drugs that are being developed for this type of lung cancer, and I'm listing some of the drugs. Some of them are more developed and have a lot of patient data. Some are very early in research, and not many patients have been treated on it. But it's very exciting to see that there's a lot of research going on for this type of lung cancer. And you might ask, how could I get access to these drugs? And one way to do it would be to search on the website called clinicaltrials.gov. I'm sure many of you are already familiar with this website, but for those of you who are not familiar, this is a clinical trial. This is a website where you can look up clinical trials. You would go to clinicaltrials.gov on the search engine, and the first top of the page is what you see, and you will put the name of the drug under other terms and press search, and you will get the lower half of the page. So you can see the study title, and you can also see the different locations where the clinical trials are available. And you could look up a cancer center that's closest to you. Now, I would encourage you to talk to your oncologist before really, putting a lot of energy into these, into looking up these clinical trials to make sure that that it's appropriate for you to start looking into the clinical trials. So in summary, EGFR exon-20 insertion lung cancer is uncommon, but very important to test. And please ask your oncologist whether you have been tested for it. Now there are targeted therapies that have been approved for use. They can be effective, but as I mentioned, side effects can be bothersome, and most people will need chemo at some point, and chemo can be very effective. I want to reiterate that immunotherapy usually doesn't work very well, so should be reserved for later. And the final very important point I want to make is that individual patient really can help advance science and develop new treatments by participating in clinical trials. With that, I will end this presentation, and thank you for your attention.